So I guess we get started now.
Yeah, let's go. Welcome to our Bio 308 presentation. I'm Anna, and
I'm Alfredo.
we chose to do our presentation on bone cancer with the intervention method of Dactinomycin.
So bone cancer is not like any other type of cancer. It arises from the bone, of course. It can be classified into two different categories known as the primary bone cancers and secondary bone cancers. Most common places for it to arise is between in the arms, legs, and pelvis, mainly in the long bones.
So the two different classifications that Alfredo just mentioned are the primary versus the secondary. The primary is where it starts in the bone, and then the secondary is where the cancer starts in another part of the body, but then metastasizes into the bone. For the primary, the most common places that this is found is in the leg, near the knee, the shoulder, and the arm. In children, this is most commonly it's most commonly found in children and adolescents and young adults, but in adults it can be found anywhere. As far as the secondary, it is most commonly found in the spine, ribs, pelvis, upper bones of the humerus, and femur. And this is more common than the primary.
I believe that the people who get the primary bone cancer, I believe it makes up for less than 1% of all kinds of bone cancer that are out there. Oh, so okay, there we go. Most common in primary bone cancer, I'm gonna be talking about three kinds. The first three kinds will be the osteosarcoma, chondrosarcoma, and Ewing sarcoma, which is we later further discussed into the research about our intervention that we keep talking about. So osteosarcoma begins in the bone, forming cells. It affects ages ranging from 10 years old to 30 years old. It is most common, like I said earlier, like most cancers, in the long bones, like the leg and the arm. Chondrosarcoma begins in the subchondral tissue of the bone, so it begins from the inside of the bone. It affects middle and older adults. Chances of increasing with age appears in the pelvis, thigh, and shoulder, meaning that although it affects middle-aged people and older adults. As you increase in age, your chances of developing chondrosarcoma keeps increasing. Ewing sarcoma form in the bone, like osteosarcoma. It affects in the children and young adults. It is rare in adults older than 30, so it's more commonly found in younger childs. Most common develop in the arm, legs, and pelvis. The survival rate for Ewing's sarcoma, the one we're going to be discussing, it is a 5-year survival rate of 82%, meaning that those who are diagnosed with the Ewing sarcoma after they've been cured, the survival rate after 5 years is 82%, compared to those who might have had a relapse or ended up dying from the cancer.
The most common types for the secondary type of bone cancer would be the osteolytic and the osteoblastic. As far as the osteolytic, this is a metastatic cancer that breaks down bone cells. It commonly affects areas of the spine, ribs, and pelvis, as previously mentioned. For the osteoblastic, the metastatic cancer forms where new bone is formed, and it grows abnormally. As osteoblasts are the cells that will form new bones. This is just the type of cancer where it grows abnormally, so there's a mutation that would occur in the DNA of the cancer cells to make it a cancer cell. The survival rate of this after 24 months is only 4.5, which is like extremely low, very real and scary for people diagnosed with this. And for 6 months, it's 50%. As you can see, this is a very fatal and serious type of cancer.
Something else I would like to add is where the where the formation of the cancer cells are passing between the osteolytic and osteoblastic. As you can tell, it's an osteoblast, meaning it's where the bone is mainly usually forming. So it'll be at the ends of the bones towards where it connects towards the joints. And osteolytic, as you can say, is the cancer breaking of the bone, which also causes can be found in the also like in the ends of the bone, but also can be found in the middle parts of the bone as well. As you can see, like things like spine, rib, and pelvis are parts of the body that have a bunch of moving parts together, which I guess it would be easier. Um, some risk factors that come along with it can increase your chances of getting bone cancer is radiation exposure, um, inherited genetic syndrome, family history of bone cancer, Paget's disease, and age dependent. Like I said earlier, some cancers tend to increase your chances as you get older. Although you may not be, um, you may not get them as a young age. As you become older, you might become a high risk factor for developing them in the future.
And those risk factors apply to most types of cancer as well. Um, the specific type of bone cancer that our intervention method targets would be the Ewing sarcoma, which is a primary sarcoma. It accounts for less than 10% of all human malignancies, common in 15 years or younger. This is already such a small um, percentage of bone cancer to begin with, so this is extremely rare. Um, it is most aggressive and occurs in the long bones and pelvis, as you can see in the picture. Um, it metastasizes to the bone marrow, lungs, and other tissues, which can be extremely deathly. It's diagnosed through a CT or CAT scan, and biopsy is considered to get the best results. Malignant tumors with the neuro sorry the neuroectodermal, which is in neural cells. I know it says normal, but I meant to say neural cells. Differentiation. The 5-year relative survival rate is 63%, which is higher than we previously discussed. The symptoms are pain, swelling, weakened bone, and fever, which could be common symptoms for other things. So it's could be hard to detect.
In the following image here, you can see also what a developing Ewing sarcoma is. But more specifically, well, how primary sarcomas also generally tend to develop within the bones. The next slide I'll be talking about will be the pathogenesis of it and how it becomes to be the cancer. So it appears, like I said, in the diaphysis of the long bones, but it happens between the translocation between chromosome 22, as you can see here in the image. This represents chromosome 22, and chromosome 11, as you can see in the second image here. You can see the part, and what happens is there is a fusion that leads to the gene product of EWSR1. The dash meaning fuses to FLI1. The EWSR1 stands for the Ewing sarcoma, and the FL1, I believe it stands for like the gene location that it fuses to, if I'm not wrong. So yeah, and this is the outcome out here, as you can see at the bottom, at the last picture.
And to the left, you can see the histology of a stain of the Ewing sarcoma. It mainly invades the periosteum and soft tissue. Histologically, they recognize by the small blue cells with large nucleus, the Homer-Wright rosette. So you can see, if you could point to the middle, that would be like an example of the Homer-Wright rosettes. And then the center would be the neutrophil, and then around it, you can see the darker stains.
Something else I would like to add that the Homer's-Wright rosettes also are composed of dendritic cells in there, which means communication between the crust of the body and presenter cells. So that's also involved within the system of the cancer cause. Now, dactinomycin for Ewing sarcoma. So,
Oh,
you want me to go?
sure.
Okay, I'll go for this one. Dactinomycin or D-actinomycin is also known. It was discovered by Selman Waxman and the colleagues. You want to talk about the rest of the slide?
Sure. The Actinomycin was first an antibiotic isolated that had anti-cancer activities, which is how most cancer treatments are discovered. It was approved by the FDA in 1964, so it's been around for a while, and it's been able to have lots of research and studies done since it has been around for a while.
And as you can see here on the right, there is a set
Yeah.
picture about how
the mechanism.
it's further going to get into how it actually integrates itself into the DNA.
Yes.
Continue. It is a non-cell cycle specific anti-tumor antibiotic that inhibits transcription by binding to the DNA, inhibiting the RNA synthesis. It is administered intravenously, often combined with the VEC regimen, which is a part. It's a way to. It's a way they cure. I believe this kind of can. It's a way to cure this cancer. Some of the side effects for this injection, it will be low white blood cells, which increase your level of infection, of course, because there are the people who fight for you, or the cells that fight for you. Low blood cells, which increase the risk of anemia. Low platelet levels increase the risk of bleeding because you now have the ability to clot. Nausea, vomiting, mouth sores, skin lesions, and loss of sterility. I will also like to add that later on about the structure a bit more. Yeah, I'm going to do the mechanism.
Yeah, of course.
All right. So for this reason, it fits between the bases in the DNA helix and its cyclic polypeptides that fits in the minor groove of DNA, causing its lethal cytotoxic effect of the cell. Also, so usually I believe between the bonds, there is a difference of 0.33 nanometers, but at the addition of this, it increases by 0.32%, making the distance between the polypeptides of 0.66, which induces the cytotoxic effect between the cells, leading the cell to be killed to apoptosis, which essentially means cell death. As you can see, the flight rate insert itself, like I said earlier, between the pairs, is able to make two hydrogen bonds with guanine and cytolytic peptide. It, intercalates into guanine cytosine-rich regions which stabilize the topoisomerase DNA complex. Essentially, it limits the RNA polymerase progression, suppressing the production of mRNA, limiting replication, and further fixing of the cell that essentially will lead to a cancer cell.
Here's just a little conclusion paragraph to tie everything that we just discussed together. Overall, dactinomycin, the intervention drug that we chose for the Ewing sarcoma, is a cytotoxic chemotherapy that targets the production of the mRNA. This ultimately limits DNA replication and results in the death of the cancer cells, which makes it cytotoxic. The intravenous drug has many side effects associated with other chemotherapies, as listed in the slide before the last one. But unlike other drugs in this category, it has a relatively high therapeutic index, which means that you can get a relatively high dosage for the amount of repercussions and side effects. This makes it a great drug for treating bone cancer tumors in patients that have Ewing sarcoma.
Another thing that I would like to add, something that I learned but I forgot to mention during this, the dactinomycin, it is one of the essential drugs that have been implemented between the health field, meaning that it is considered top 10 today. It's considered in the top 10 of the list, which are essential for every medical, I guess. If you were to make like a box that you wanted to put like the best essential drugs that you needed to cure anybody, you would put that drug in there because it's known to be such a strong antibiotic within the system. It was discovered first as antibiotic, but it was deemed to be, like you said, toxic to the human body in high dosages. And I believe that should conclude our rest of our presentation about the diceytomycin. As I feel like the more I say, I can't pronounce it.
Yes. Here are our citations, and